possibility from Excel Academy. Kindly take note that Excel Academy has opened up its new branch at Ridgeway campus. This simply means that you can access our physical classes both at Ridgeway campus and at main campus. The good news about our classes is that our timetable is in line with your timetable. This simply means that whenever you have a class which is scheduled to end at 20 hours, with us, we are going to reserve a class for you which you are going to learn at the convenient time. This simply means that as Excel Academy, we want to make sure that you do not lag behind and you have the full understanding. In today's class, I have a simple task, and this task is to explain the histological technique and the microscope. But my major focus will be on the histological technique. When we talk of histological technique, we are simply giving an introduction to the basic histology. When you talk of histology, histology is just a branch of human anatomy which deals with the study of tissues. And this branch of anatomy, it deals with the use of a microscope for us to see the content of a tissue. As you are aware, every tissue has different content. For example, the appearance of an epithelial tissue is totally different from the appearance of a connective tissue. Let me quickly give an highlight on one of the difference between the two. You need to understand that an epithelial tissue can be glandular or a cavally. When you talk of these two tissues, you discover that these two tissues are avascular. That simply means that they do not have the blood supply system. On the other hand, connective tissue have blood supply. This simply means that they are vascular. So when you talk of histology, this branch of anatomy is going to give us a full detail of how a tissue appears using different types of dye, which we normally call the stains. So look at this tissue. This is an epithelial tissue. So if you look at this tissue, this side is an epithelial side of a tissue, and this part is the connective tissue. And there you have some other layer, which is the cilia layer, which is on top of the layer there. So for us to see all these contents, such as the goblet cells, as you can see from here, such as these goblet cells, which are filled up with the mucus, for us to see all this content, it's because this slide was viewed using a microscope. And the branch of human anatomy, which is helping us to understand the content of this tissue, it is what we are calling histology. So histology, it is coming from the Greek word, whereby the word histo, it's just simply mean tissue or a web. Why are we saying that tissue or web? When you talk of a tissue microscopically, it normally looks like a web of structure. This web of structure, it is just making up two important content of a tissue, of which we have the cellular content and the extracellular matrix content, of which these two, they relate to each other. What does that mean? This simply means that the two content of a tissue, they work hand in hand and depend on each other. Alright guys, so like I said, when you talk of histology, histology is just the study of tissues of the body and how these tissues are arranged to constitute an organ. We all know that a tissue is made up of the same type of cells. A tissue is made up of the same type of cells, and these cells have a specific function. And a group of different tissues, they make what we are calling an organ. For example, the stomach. The stomach constitutes of what? The epithelial tissue, the connective tissue, the muscle tissue, the nerve tissue. All that is what can be explained when you talk of what histology is all about, studying the tissue and how this tissue works together to form what we are calling an organ. Alright guys, so the content of a tissue, like I have shown in this slide, you cannot see the goblet cells using your naked eyes. It is totally impossible. You cannot see that. But when you use a very important instrument, a very important device, which is known as the microscope, this microscope will help us to be able to see the content of a tissue. So in the study of a tissue through the branch of anatomy, which is histology, we normally use a very important device or instrument which is known as a microscope. All right. So, what exactly are we supposed to focus on when we talk about a tissue? Like I said, a tissue is made up of two important contents. And these two important contents, they work hand in hand, okay? For example, this is a very good diagram that I have for you. So this is the extracellular matrix. The extracellular matrix, it also depends on what we are calling the cell. So we have a cell here. We have the extracellular matrix. What does this simply mean? This simply means that a tissue is made up of two important components, the cell component and the extracellular matrix component. Remember what I said. The cell component depends on the extracellular matrix, and the extracellular matrix, it also depends on the cell. The big question we can ask here is that how do they depend on each other? So when you look at the cell here, the job of the cell is to produce the extracellular matrix. The job of the cell is to produce the extracellular matrix. Just like in a relationship, there should be some benefit that you are getting from the other side. So when you look at the cell, yes, the cell is producing this extracellular matrix, but it also needs something in return. And what is that which the extracellular matrix is offering to the cell? And the answer is that the extracellular matrix, in return, it supports the cell. So the cell produces the extracellular matrix, and the extracellular matrix supports the cell. Just like I said, a tissue have two interacting components. The keyword is interacting component. This simply means they operate together. They operate together. The same way I can talk about Excel Academy. Most of the people say, Excel Academy is run by Dr. Possibility. No, that is totally wrong. Excel Academy is run by different tutors. We interact. We depend on each other. This one brings an idea. This one brings an idea. We work together with you as students who are also making this academy to prosper. Same applies with a tissue. It having two interacting components, the cellular component and the extracellular component. These two are working hand in hand. Like I said, the extracellular matrix, it supports the cell, and the cell produces the extracellular matrix. This statement will be very important when we talk about different types of tissue, such as the bone tissue, such as the epithelial tissue, the connective tissue, muscle tissue, and so on and so forth. Alright guys, now remember what I said. We are interested much in knowing how these tissues have to be prepared in order for us to appreciate the content. So for the tissue, like the tissue I've just shown above there, this tissue, let me quickly go up. For this tissue to be shown, for us to appreciate the nucleuses, these dark spots are nucleuses which are on different levels, and this normally can tell that this is a pseudostratified columnar epithelial tissue which is in the respiratory tract, and as you can see, this is the ciliary layer which is there. So for us to appreciate this content, this slide or this tissue had to undergo different techniques, and these techniques are in readiness of tissue preparation. Now, as we prepare the tissue, we need to understand that the morphological and the chemical content of a tissue need to be preserved, need to be kept. Nothing should be changed. Nothing should be tempered. The metabolic reactions have to be intact. We need to appreciate the collagens. We need to appreciate the nucleuses. We need to appreciate every content of a tissue. And how can that be done? This is a reason why there are a series of techniques which are used to preserve a tissue, which will later on be appreciated using a microscope. So if you look at this diagram which I've just shown here, this is the mammalian breast. In this breast, you'll find that there is this chemical which has been used. Okay, this chemical is just helping us to preserve the content of the mammalian breast. Okay, we need to appreciate what it is made of. That's why we are studying it. Remember, you need to understand how a normal kidney, a normal thymus, a normal respiratory tract epithelial looks like under a microscope. Why? Because you need to understand that these cells can easily undergo cell injury, okay? And this can lead to cases such as metaplasia, hyperplasia, and many likes, whereby the shape, the size, or anything is being changed to this cell. So if you understand how an epithelial in the respiratory system, a respiratory tract looks like, for example, you know that the tissue, the epithelial tissue in the respiratory tract has to be pseudostratified ciliated columnar epithelium. Okay, and then as you examine a patient, because a patient maybe is a tobacco addict, you discover that because of the change of environment in the respiratory tract, that epithelium will change from the columnar type to squamous, so that they are able to accommodate that change in the chemicals which are in the tobacco. So you, as someone who has studied histology, you'll be able to know, no, this is squamous instead of what a simple columnar pseudostratified columnar epithelium. And you can easily state that these cells have undergone a certain type of cell adaptation which is known as metaplasia. There are cells that can undergo some cell death, and it can be either apoptosis or necrosis, or that can easily be examined when you truly understand the tissue content. So histology is very important because as we prepare these tissues, we need to make sure that the contents are intact. So what does this mean, or what are we interested in? So what we are interested in is knowing the steps, necessary steps that are carried for us to do what? To understand the tissue using a microscope. So the first step in tissue preparation is preservation. Preservation, it can also be said as fixation. So in this type of tissue processing, which is the very first step of tissue preparation, which is fixation. So fixation is the first step in tissue preparation. This step involves the preserving the content of the what? Of a tissue. For example, this is the brain. Let's say in this case we are much interested in knowing the nervous system, which is basically, we can talk about the central nervous system. Remember, the nervous system is classified into two types. We have the central nervous system and we have the peripheral nervous system. The central nervous system is the one which has the brain and the spinal cord. So let's say we are interested in knowing the content of the central nervous system. So for us to understand the nerves, the content of a nerve, such as the dendrites, such as the axons, okay, because you need to understand how many branches does a nerve has, okay, how many processes does it have? Is it unipolar? Is it multipolar? Is it pseudopolar? All that need to be appreciated. Okay, so we can only appreciate such content if we preserve. So the first step in tissue preparation, the first step in histological tissue processing, the first step is what? Is preservation. And this preservation is known as fixation. So fixation is the first step which is carried in order for us to preserve the what? To preserve the tissue. Okay, now there are chemicals that are used to preserve a tissue. I'm pretty sure everyone has been exposed to the dissection room, which is known as the GR. So in a dissection room, we would see some cadavers there. So these cadavers are preserved. Their content is preserved, and a fixative, which is being used in most cases, is formalin. So that formalin is just there to terminate any biochemical reactions that may take place in that organ or in that cadaver. So if these processes are being stopped, if these biochemical reactions are being stopped, that means that we are going to prevent the organs or the tissues from what? From decaying. We are going to protect the tissue from what? Decaying due to what? Autolysis or putrefaction. So when these tissues are being put in these chemicals, there are different chemicals that can be used. A very good example I've talked about is what? Is formalin. Okay, so let's quickly look at the chemicals that are normally used in order to preserve a structure or a tissue. The first chemical we can talk about is formalin, which I've already mentioned, and I've related it in terms of cadaver. So formalin is the most common use chemicals. Okay, the next one is mercury chloride. So mercury chloride is just a compound, it's just a chemical which is made up of chlorine and mercury reacted together to make mercury chloride, and this can also be used to preserve. Then we have acetic acid and picric acid. We also have ethanol, and we also have methanol and glutaraldehyde. All these are used to preserve a tissue. I am going to give the tips during our physical classes how you can know these guys and why you should know them. So make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. All right, I'm pretty sure we are following. But the big question is, why are we preserving the tissue? Why are we doing fixation? Remember, the first step is fixation, but why are we doing it? Look, if a tissue is not preserved, if a tissue is not being put in these chemicals such as ethanol, acetic acid, formalin, mercuric chloride, all those chemicals we mentioned previously. If these tissues are not preserved, they might end up what? Decaying. Okay? They may end up what? Decaying. So when they decay, that simply means that we're not going to appreciate the what? The content of that tissue. And remember, as they decay, what will happen is that the morphological and chemical component of this tissue will simply be changed. So all that are one of the reasons why we are preserving the tissue, more reason why we are making the tissue to undergo fixation. So the first point you need to understand that the purpose of fixation is to preserve the morphological, the shape, okay? We need to know that this is the goblet cell. We need to know that this is the pseudostratified epithelium. This is simple squamous epithelium. Okay, we need to understand the content. We need to understand that this is the epididymis having a lot of cilia. We need to understand such content. Okay, so even the chemical composition, like I talked about the goblet cells. The goblet cells, these cells, they normally produce what? The mucus. So it is because of such content, the chemical content of the goblet cells, that will help us to know that this is the goblet cell. So the main purpose of fixation is to preserve the morphology and chemical composition of a what? Of a tissue. Then to avoid decaying or decomposition, which is normally caused by autolysis or putrefaction. The other one is to harden the tissue for easy manipulation, for easy understanding, for easy interpretation, for easy analysis, because these tissues, they'll help us to understand the pathological injuries, physiological injuries that a tissue might have passed through, to also solidify colloidal materials and also to influence staining. Look at this. You cannot see the nucleus if at all you haven't stained it. You cannot see the collagen if at all you haven't stained the what? The tissue. We cannot see the reticular fibers without using the what? The staining. So the main purpose, one of the purpose of fixation is to influence what? Staining, okay? So that these stains can easily penetrate through. These stains can easily give us the full details of what we are interested in. Alright guys, I'm pretty sure you're following up, so make sure that you understand. Now, You need to understand that some tissues, such as the bone tissues, they have what? Calcium. Some tissues like the bone and also the tooth, they have what? Large amount of calcium. As a result, there is an added step, which is decalcification, the removal of calcium from the tissue, so that we are able to understand it. So guys, in case you have any question, please drop them in the comment section. In case you have anything, please drop it in the comment section, and make sure that you subscribe to our YouTube channel. Okay guys, so this is just a picture of our class, how our class looks like. Very comfortable, very nice, a good place, better than anything that you can think of. So make sure that you come and register with us. We are just 5 minutes away from Ridgeway campus. Look at that. Look at that short distance. 5 minutes away from Ridgeway campus. That simply means that you can come all the way from your lab. You just come and attend our class for 1 hour. We simplify everything within that 1 hour, and you are all well and good to go. Then if you have a class at 20 hours, then automatically we are going to have another class specifically which has been indicated by the timetable, and we are going to offer you the service on the day which you are normally free. So make sure that you register with us. Make sure that you also subscribe to my YouTube channel. So fixation is done. The tissue is preserved. Biochemical reactions have been stopped using different chemicals which I've already mentioned, such as formalin, acetic acid, mercuric chloride, ethanol, and many others. The next step is tissue processing. So I'm encouraging everyone to know this tissue processing in order. So tissue processing is the next step after what? Tissue fixation. And tissue processing is being divided into 3 stages. Make sure that you know them in order. Tissue processing is the next step which follows the fixation. So tissue processing is being divided into 3 steps. The first step is dehydration, whereby water is removed using ethanol. The next step is clearing, followed by the last step, which is embedding, whereby now this tissue will be put into a certain shape of interest. All right, like I said, tissue processing is divided into 3 stages. The first stage is dehydration. The next step is clearing. The last step is embedding. And then from there, we can talk about tissue sectioning, tissue staining, and we are done. So let's quickly look in detail about these important points. So the first stage of tissue processing, like I said, it is dehydration. So when you talk of dehydration, it is just the removal of water. Remember, these tissues we are dealing with are tissues that are having water. So yes, you have to know that dehydration is the removal of water, but the most important thing you need to know is what is being used. Okay, you need to know what is being used to remove this water. So the chemical which is used to remove this water is what? Ethanol. But yes, you know it is ethanol. But the next question that you need to ask yourself is that how is this ethanol working? How is it added for us to remove this water? And you need to understand that this ethanol is being used to remove water in what? In stages, of which these stages are being put into 4 categories. The first one is 50% of ethanol, then 75% of ethanol, then 90% of ethanol, and lastly 100% of ethanol, which is known as the absolute. So this is just what I have simply explained. One important thing I've talked about is the use of alcohol. In this case is ethanol, and then this ethanol is added in stages. The first stage is 50%, then you have 70%, then you have 90%, and lastly it is absolute alcohol which is being used. But why is ethanol being used? That's a very good question. So from our knowledge at first year, we understood that ethanol is a polar compound. Because it is a polar compound, that simply means that it is miscible. That simply means that it's able to interact with water through the creation of what? Hydrogen bonds. So because ethanol is able to interact with water, as a result, it is a very good solvent that can be used. Okay, don't mind about the paraffin wax, which is going to be explained when we talk of embedding. So like I said, these things are done in intervals, and normally these grades, they have to last between 30 minutes to 60 minutes, which is just 30 minutes to 1 solid hour. So the whole process of dehydration, it normally takes about 2 to 4 hours, depending on how the tissue is, the content of the tissue, the area of interest. So you find that this whole stage of dehydration takes place in 4 hours. So water has been removed. What are we using now? We have used what? Ethanol, and this ethanol has been added in intervals. The big question is, what's next? Clearly, isn't it? We need to make this tissue to be so clear. We need to get rid of the ethanol, which we have already added. We need to get rid of what? The ethanol. So the next step is what? Clearing. So when you talk of the next step of tissue preparation, which is clearing, in this case, we normally use paraffin solvents. And this solvent, we can talk about the xylene, benzene, toluene, chloroform. All those are what are important paraffin solvent. Paraffin, you need to know that paraffin doesn't dissolve in what? In water. So we need something in which paraffin can dissolve. Okay, we need something in which paraffin can be dissolved, and that which we are going to use, it need to help us so that when we introduce embedding, that solvent which has been introduced will be able to interact with what? Paraffin wax, and then the tissue will be embedded. So under clearly, this is where by now the tissue is treated with a paraffin solvent. Take notes. We are not saying that at this stage we are using paraffin to treat the tissue. Please take note of that. Don't say no, we used a paraffin. No. When clearing, we don't use a paraffin. Instead, we are using a paraffin solvent. What is a paraffin solvent? This is just a liquid in which paraffin can what? Can dissolve. Okay? Remember, when we wanted to remove ethanol, when we wanted to remove water, we use something that is miscible with what? With water, which is ethanol. That's how water was removed. So when you talk of clearly, we need to introduce a solvent, a liquid in which paraffin is what? Is miscible. Okay? And such compound we can talk about, like I have said, you can talk about xylene, you can talk about benzene, you can talk about chlorophene, you can talk about what? Toluene, and you can also talk about what? Petrol. And this reaction, this stage takes for 2 to 3 hours. Dehydration is taking place between 2 to 4 hours. Clearing 2 to 3 hours. And the chemicals which are being used, which are clearing agents, are xylene, toluene, chloroform, petrol, and also benzene. So make sure that you understand that what are we doing here? So these agents, they'll just simply pass through the tissue and they are going to replace what? The alcohol. Let me quickly look at what I've just simply said. So you have done fixation, okay? So when you do fixation, water is present. The next step which you follow is what? Dehydration. To remove what? To remove what? Water. And this water will be removed in what? In content, okay? In stages by introducing what? Ethanol. So after that, we are now going to use what? We are now going to do clearly to remove what? Ethanol, okay? Remember, the tissue had what? Water, okay? As we know, water is one of the content which is in every tissue, every cell, okay? So first, water is removed at dehydration using ethanol. So when you talk of dehydration, we are using ethanol to remove water. Now that ethanol also need to be removed, okay? Also need to be removed, and that ethanol will be removed at the clearing stage using what? Paraffin solvents such as xylene, taurine, chloroform, petrol, and also benzene. From there now, we are now going to go to the next stage, which is what? Embedding. Remember, on embedding, we need to come up with a shape of a tissue. We also need to introduce the paraffin wax because we already have something in which paraffin can dissolve. So embedding, this is a type of, this is the stage which is now also classified into two types. And then when you talk of embedding, there are various embedding medias which are used, such as paraffin wax, okay? So paraffin, like I have said in the previous slide, I've said we introduce paraffin solvent so that when we come to embedding, this paraffin will be able to interact with what? With those solvents, okay? With those solvents. And then this thing will be solidified. When it is solidified, then what's next? It's the use of a microtome to cut these tissues into sectioning. Everything is intact. Now we need to section it. We need to cut it. We also need to stain them, okay? So we have embedding media, we have embedding material. One good example is what? Is the paraffin wax. Now embedding is being classified into two important categories. The first one is what? Is impregnation. Okay, so under impregnation, this is where the tissue is now being impregnated with what? Molten paraffin wax. So this is where now paraffin wax is being put into the tissue which was cleared, the tissue which is looking clear, okay, the tissue without ethanol. So now that tissue has been collected. Now it needs to be embedded, but this embedding is further classified into what? Into two categories. The first category is impregnation, whereby now the paraffin wax is being introduced to the wax, and this wax is allowed to melt or to solidify. All right. After impregnation, we have casting or block making. This is where now this tissue is made into the shape, or this shape is now being made into block likes, and these blocks will be gotten and being sectioned. Okay, all right, we're done with tissue processing, isn't it? Let me quickly go back and discuss something very important with you guys here, where I talked of something that is very important. Where is it? That one there. So I said the first step is fixation, followed by dehydration, then clearing, then embedding. This embedding is classified into two types, okay? There is two stages, sorry. There is, the first one is impregnation, okay, whereby the paraffin wax is being introduced, and this is put in the oven, and the paraffin wax is allowed to melt. Then after that, this melting thing, it will be gotten and put into an L structured mount, and in this guy, that's where now this will be allowed to cool and solidify. So that stage I've just mentioned is known as casting or block making. We can also use that word, block making. Yeah, such. Okay, then after embedding, the next question is what's next? Okay, after embedding, the next question is what's next? Okay, so the next part is now sectioning. This is where now we are going to use a very important instrument which you are going to be asked in the histology lab, a microtome. So a microtome will now be used to section. Okay, it will now be used to cut. Okay, to cut that tissue into small pieces, and these small pieces will now be what will be stained, then viewed using a microscope. So in this part, I'm much interested in this guy, which is the microtome. So the microtome is just a very important machine which is just simply used to cut the slides into pieces approximately 5 to 7 micrometer thick, so that they can be stained and now examined. So after sectioning, these guys are being incubated. These guys are being kept and dried overnight at 37 degrees. All right, so after sectioning, the next part is staining. What is staining? What is involved? What is being used? That's what we need to ask ourselves. And how can you stain? It's not all about getting using, put it in a tissue, it turns whatever color you start viewing. No, when you talk of staining as procedure, which is known as staining procedures. So before you stain any part or any component of a tissue, you need to understand two things. One thing that you need to understand is what is the content of that component you are interested in. Is this content basophilic or acidophilic? Or this component need a special stain for me to understand it? So because of staining, organelles or tissue content can be classified into acidophilic or basophilic, depending on which stains is dyeing them. So during staining procedures, we can either use a basic dye to do what? To stain something that is acidic. Okay? And then we can also use a acid dye to stain something that is what? Basic. Okay? So in this case, you as a student, you need to understand which organelle, which component of a cell is what? Is acidic. So for example, you can talk about the nucleus. So because the nucleus is capable of storing genetic information, genetic material, and this genetic material are the ones which we are normally calling the DNA. Okay, and when this DNA undergoes DNA replication, then DNA transcription, it will produce RNA, and this RNA can be rRNA or mRNA, of which the mRNA will have to undergo maturity for it now to pass through the pores of the nucleus through the nuclear envelope, then it will leave and it will go now into the cytoplasm. So when you just look at the nucleus, the content of the nucleus, you need to understand that the DNA is acidic in nature. As a result, for you to stain the DNA, you need to use the information of chemistry, which is titration. So a basic dye can only work on an acidic component. As a result, because an acidic component such as the nucleus, such as the mitochondria, they can be what? They can be stained by a basic dye because they are what? They are acidic. Okay? Then when you talk of the basic dye, these such as proteins, these guys can now be stained using the acidic dye. Alright. Now, with that reasons, we need to understand that the tissue component which are stained by basic dyes are known as what? Basophilic, and normally they tend to become what? Blue in color. So any component of a tissue which is being stained by basic dye, for example, like I have said, the nucleus, the mitochondria, okay, DNA, RNA content, those guys, they are being stained, but you need to be careful with the DNA. You need to be careful when you talk of it, because this same DNA, because of the content of the glycogen, this DNA can be stained using another chemical, which we are going to explain later on. Okay, so tissue components that are stained by a basic dye. When you talk of examples of basic dye, you can talk about methylene blue, such a dye is a basic dye and it can be used to stain this guy. Then tissues that can be stained by an acidic dye are known as acidophilic, and these guys, they normally tend to stain pink or orange. A very good example of an acidic dye is orange G, which is a very good dye which is used to stain basic dyes such as the protein content of a cell. So let's quickly look at the examples of basic dye. The first dye is hematoxylin, some which is just H there, hematoxylin. Then we have toluidine blue, we have Asian blue, you have methylene blue. And when you talk of acidic dyes, you can talk about usine, you can talk about orange, you can also talk about acid falciform. Please know these dyes by heart, know their category, know what they stain, and the color, how it appears. Automatically, when something is stained with an acidic dye, it will either be pink or orange. For example, when orange reacts on anything that is basic, anything that is acidophilic, then it will appear as orange in color. Using, when it reacts there, it will normally produce something that is pink in color. So in some cases, you discover that these dyes can easily be combined to form one continent. So for example, if hematoxylin and usine are being combined, they normally form what we call a dye, which is H and E. H and E is a very important dye, and you need to understand which of these two dyes is a counterstain dye. I'm not going to say it now. I'm going to reserve that for our registered members, because that's a very, very good exam questions which you need to be exposed to. So when these dyes are being combined in a case of H and E, like I have mentioned, this is whereby you also need to understand between the two which is the counter stains. So guys, I'm encouraging you guys to make sure that you register with us. Fact at hand is that you guys are being taught in a large group of number 500, 600. Basically, most of you don't understand. But with Excel Academy, we'll make sure that we make you understand. We expose you to exam questions which you are not exposed to, and we are going to reduce that pressure. Believe us, give us a month, register with us, give us a month, and you see how much impact we have with our services. Okay, so we have special stains, and one of the special stains we can talk about is pus. So pus is basically used to normally work on tissues that are made of glycogen. For example, when you talk of DNA has a glycogen content of it, and as a result you can use pus to identify. Okay, so pus is just the basic fussing. Remember, we add an acidic dye somewhere. So this dye, the pus dye, is normally react with glycogen and make it to look red in color. When it is stained, a tissue is stained with pus. This pus will go and target the glycogen part, and this glycogen part will look as red. Guys, I'm emphasizing on the same thing. Make sure that you register with us. Let's cooperate together. Let's work as a team, and we'll surely make it. Nothing is impossible in life. The next one is osmic acid stain. This stain is normally used to do what? To stain regions which are made up of lipids in general, and also lipids in the nerve fiber. There is an important question which needs you to use the answer osmic acid stain. It is not phrased the way your notes are being made. So such content, I'm going to explain it to our registered students. All right. So Excel Academy is not operating the way you might think we are operating. As Excel Academy, every tutor, the way they have to explain it, it's in such a way that it is 2 times better than the way you are being taught, the way your tutorial videos are, your way whatever is. So the way our notes are set up is that after every section of explanation, there are exam questions. Is this not nice? Just look at this. What does this mean? We are now helping you to revise before you even get tested. We are helping you to know how the exam is set before you are even being examined. Meaning, when the tests are approaching, you would not need much effort, much 100% time focusing on one course when other courses are pending. So as Excel Academy, we are working on that. We are helping you on that part. So here's an exam question. The following is the ascending order of tissue preparation step in histology. So the answer here is fixation. Remember, I told you that dehydration, clearing, and embedding, you need to know them in order, as these makes up the tissue processing stage. Reticular fibers are dash. Should I tell you this? Or maybe I keep it for our students? Okay, let me tell you this. So the answer here is aerophilic. What does this mean? This is because reticular fibers are being stained black when they are dyed with silver stain. So when silver stain is used on reticular fibers, these guys, they readily change into black. So mostly components which are stained by silver stain are known as angirophilic. Angirophilic meaning they can be stained by salts such as silver salt, which is just known as silver stain. This same question has another way in which it is being phrased. Let me quickly look at the next one. All are basic dyes except that. So remember, I talked of these dyes and I gave examples of these dyes. So in this case, the answer is orange G, which is in the category of basic dye. Guys, register with Excel Academy. All right. The next one is the following dye constitute the Giemsa stain. Should I tell you the answer or I keep it for register students? What do you think? All right, we are a team. We need to work together. The answer is B. So on this question, if you look at my explanation, it doesn't have this component. Even your lecturer's notes, some they don't have this component. What am I trying to say is that staining is a part in histology where no notes are enough for you to understand that topic part or that part. You need more research. You need more interactions with someone with much experience to tell you, okay, this one comes, this is how this one comes, this one is not in your notes. You can find it here. That's where Excel Academy comes in. So this one is an exam question, but it's not in your notes. So the answer is methylene blue and using, but there is also another dye which is used, and I'm going to give you as a research, an assignment. All right. One of the following is a basophilic tissue. So when you talk of a basophilic tissue, this is the tissue that can be stained by a what? By a basic dye. And this tissue need to have a what? Need to have an acidic content. So when you look at this one, most of you may be wondering, oh, maybe it's the nucleus. No, man. Remember, the mitochondria has DNA in it. This can be explained in embryology, whereby we say the intelligence of the child comes from the mother. Why? Because the mitochondria content of the sperm does not get transferred to the zygote. So in that case, you need to understand that the DNA content is the one which is the area of interest. Anyway, the answer here is the mitochondria, because mitochondria has what? Has DNA. As a result, it is even able to undergo binary fission, which is due to mitosis. You got that? That's also an exam question. All right. Smooth muscles can be best differentiated from collagen by using trichrome. This one is for glycogen. Hematoxylin and leucine, this is just a combination of two. And then methylene blue, it is a basic dye used to stain anything that is acidic, such as DNA, RNA, the nucleus, the mitochondria. Okay. Choose the correct statement. Like I said, the first example I told you that this question is phrased into another way, whereby we said reticular fibers are angirophilic. So in this case, the answer is reticular fiber. Why? Because reticular fibers are best stained by silver stain. What of this one? Collagen's fibers are what? these collagen fibers, they are proteins in nature, so that means that they are acidophilic. Okay, so ladies and gentlemen, in my next class, which is the microscope, I'm going to explain what a microscope is, what you need to know, what the examiner is interested in knowing, what are some of the content which are not in your books, which are not in the lecture notes, but yet they are in your exam. So in the meantime, guys, I'm encouraging you all to register with Excel Academy by simply inboxing me on WhatsApp using the line that I have written there. Thank you very much. This was your friend, your brother, Doc Possibility. Have a blessed day. One more.